Hello and welcome back to Politics and Polls. I'm Julian Zelizer, a professor of history and public affairs at Princeton University. This is my colleague and co-host, Sam Wong.
Hi there, Sam Wong, professor of neuroscience and director of the Princeton Election Consortium.
Sam and I are continuing with our conversations about the pandemic. We've been inviting people from different disciplines and different positions in fields that are involved with the current crisis to hear different perspectives and think through different issues. One of the issues that is front and center has to do with the ways in which economic inequality and economic insecurity is playing into the way this pandemic is unfolding, as well as some of our responses to the current crisis. The kinds of divisions that social scientists have been looking at across society before this ever started, from the kind of healthcare people receive to the economic well-being of different communities, are all very relevant to the current situation. And to discuss some of this with us today, we are really honored and pleased to have Sir Angus Deaton, currently a senior scholar at the Woodrow Wilson School, where his interests lie in the issues of poverty, inequality, health, development, well-being, and the use of social science, of evidence in social science and medicine. He's a member of the National Academy of Sciences, a corresponding fellow of the British Academy, an honorary fellow of the Royal Society of Edinburgh. He's a fellow of the Econometric Society and was the first recipient of the Society's Frisch Medal. He also, of course, was the recipient of the Nobel Prize in Economics in 2015, and in 2016, he was made a Knight Bachelor for his services to economics and international affairs. He recently published a book with Anne Case called Deaths of Despair and the Future of Capitalism, which received a lot of attention and will be part of our discussion today. Angus, welcome to the show.
Thank you very much. Delighted to be here.
So maybe we can just start with what you had been working on before. You have argued that mortality rates were increasing before COVID-19 ever started. Can you just walk us through why and what was happening?
Well, the mortality rates were increasing for a particular social group, which is people who do not have a 4-year BA in the United States. We first identified that in middle age, but it's actually happening to younger people too. And even the people in middle age, their all-cause mortality is rising. But the thing we identified as the fastest rising causes of mortality for that group are these three things that we come to call deaths of despair, which are suicides, drug overdoses, and alcoholic liver disease. And we're actually looking at one of the figures right now, and that shows these three diseases rising very rapidly over time, these three causes of death rising very rapidly over time for people who do not have a BA. And there's very little such increase, a little bit, for people who have a BA. And each successive birth cohort is doing worse throughout life from these deaths than the previous ones. So that people born in 1985 or 1980 are doing worse than people born in 1965 or 1960, and they're doing worse than people born in 1945, and so on.
And for people who don't, for people who have the book, this is figure 4.3.
Yeah, thank you. So, I mean, the story we tell is that life has just sort of come apart. There's been a destruction of a way of life for less educated Americans starting in the 1970s and so on. And that, you know, that's come with a loss of much, including marriage rates. There's been a big explosion in out-of-wedlock childbearing. People are not living together with their children in many cases because they've had multiple cohabitating relationships. They're experiencing a lot more pain, pain of all sorts, social pain as well as physical pain. They're not going to church anymore. They don't have unions to belong to anymore. And there's just a lot of destruction of the pillars of working class life in America over this very long, prolonged period. We think that's behind these deaths.
So the despair isn't simply or exclusively a result of economic hardship and the struggles that come from that. it's also a result of the erosion of the social fabric of these communities that comes alongside with these economic struggles.
That I think is exactly right. You know, the economic hardship may be deep on the causal chain, as it were. You know, it sort of starts there. But, you know, if you get economic hardship during a recession, for instance, during the Great Recession, it just doesn't do this. It's this long-term destruction of a way of life that's really harming people, not the short-term fluctuations associated with a recession. And of course, that's become important as a talking point in the current deliberately induced recession.
But there have been, I mean, there are these different ways of looking at the same problem. So now we've so far talked about whites who don't have a BA, who are bearing the brunt of these deaths of despair. And we've also talked about pain, but these things aren't necessarily uncoupled from one another. Say if we, in your book, you write about loss of opportunity, this lack of upward mobility, the lack of prospects of either improving your lot or of doing better than, say, the previous generation. All those things can have lifelong impacts, including health impacts. And so when you write about pain and about the opioid industry and addiction and the problems that come with that, it seems to me that now we have this problem of looking at these two different problems. One is availability of opioid drugs and addiction. Another is lack of prospects, lack of hope for what the future is going to be like if you're, say, growing up post 2000, which is when your data suggests that these problems started really taking off. How does one uncouple cause and effect in that case?
Well, it's not an easy thing to do. We don't have very good data on hope. So what you say is extremely plausible, but we can't directly look at that.
Yeah, I know that
hope measures are not great. But you said in the 1990s, we placed the beginnings of this back much further in the people who entered the labor market from like 1970 onwards. And since then, there's been steady erosion of wages for men without a BA. And that's, you know, it's now a 50-year process in which these wages have gone down. And it's that sort of slow drip, drip, drip that, you know, has destroyed communities, made that way of life much less tenable. Now, you mentioned opioids. You know, opioids, obviously, that didn't have to happen. And it didn't happen in other countries. You just don't get these enormous number of deaths from opioids being pumped out into communities. But it's clear that pharma companies targeted places where there was already pre-existing despair. And so they sort of peddled drugs in those communities. So in some sense, you know, if the FDA had never allowed those drugs, or if physicians had never sent people home with, you know, boxes of OxyContin with 30 or 60 tabs in them, then a lot of this would not have happened. But the pre-existing despair interacted with the opioid deaths.
To just illustrate what Sir Angus is talking about here, let's see, this is now figure 11.1 from the book. And to orient people, this is just to support what Sir Angus is saying about when this began. So this is now a graph for those of you who can see it. It's a graph of earnings as a function of age on the horizontal axis, not year. And each curve is for people born in a particular year, whether it be 1940, 1952, 1972, and so on. And the idea is that when the curves go up, it means that as you're getting older, you have the prospects of making more money. And the curves are all going up in what I would call a pretty satisfactory manner for people who have bachelor's degrees, much less so for people who don't have bachelor's degrees. And if you look carefully, these curves are going, each curve is a little lower than the other one the later people are born. And so what I see, at least looking at this graph, is that people's economic prospects have gotten worse starting, looks to me, I guess to my eye, it looks like in the 1970s, as in terms of these curves getting lower and lower underneath one another. And so if you look at this curve here, it goes from, for people who didn't go to college, here, and then gets lower, and then lower, and then lower. And as these curves get lower and lower, it means that you do worse than the generation before you. So if you went to college, you can do as well as your parents' generation. But if you didn't go to college, then things are sinking lower and lower. And so I think, am I correct in saying that this is the kind of thing that people should be looking at as they read your book?
Yeah, absolutely. And it's true that for people with a BA, they're not only doing as well or better than their parents did in some sense. So the gap in earnings between people with and without a BA, which used to be traditionally, economists would tell you, was about 40%. It's now something like 80%. So that college, non-college distinction has become much more salient, both in terms of earning and also, I think, socially than it once was. And we've sort of valorized this extraordinary distinction between a BA and a non-BA to the extent that the people with a BA, this educated elite, is doing just great. And the people who don't have a BA, they're facing worse and worse opportunities as time goes on. And then you lay this irresponsible behavior of pharma companies and opioids on top of that, and you get the sort of catastrophe that we talked about in the book.
Now, some people said when the pandemic started, this was the great leveler and that we were all in the same boat together. But obviously, as time goes on and we think more carefully, that's not true. In terms of the communities you study, what are you looking for in terms of the problems you were looking at before this and how this might exacerbate some of those economic and social problems?
Right. Well, the great leveler argument is an interesting one, because if you look at pandemics historically, if you go back to the Black Death, they were levelers. They really were levelers. So was smallpox. And it's basically because it doesn't matter how rich you were, how powerful you were, you really couldn't escape these diseases because we didn't understand them. Even in 1918, when people were dropping dead, they had no idea what they were dropping dead of, because no one understood the transmission mechanisms of what was actually going on. But here we have so much more understanding, which we can use to handle the disease. So at the very, very beginning, it's hitting Prince Charles and Rand Paul and Boris Johnson, and the Afghan presidential palace is full of COVID. So there's this sense in which it's coming for everybody. But we understand now much more about what causes those diseases. So the social distancing, for instance, social distancing works in favor of rich, educated people. I mean, the three of us are all sitting at home. We're being paid. We're working as hard as we ever did. And we're reaching lots of people around the world. So this is not really harming us, certainly economically. And because we can do our work at home, it's not hurting us health-wise. But, if you're an essential worker, then you're out there in your grocery store, or you're driving your bus or your subway train. And, all of those things put you in danger. So the essential workers, now many of the essential workers, like doctors, belong to the educated elite, but there are more of them who work with their hands, who don't, and they're putting their lives at risk. It's also true that the educated elite have not lost their salaries, whereas a tremendous number of the people, without a BA are people who are at high risk of having lost their jobs. Maybe they'll get unemployment benefit, maybe they won't. And of course, in this demented system we have in America, many of them lost their health insurance. Some of them will be able to get it back, but it's clear that many will not.
And the second part of that, in the ways that social distancing and any fracture of social institutions continues, even in these communities, from what you said earlier, that would be even more severe since it was broken to start with. Is that correct?
I think that's more an issue of poverty. So, in the book, we don't finger poverty because these white people without a BA, in many cases, are not the poorest people in America. Mm-hmm. Whereas now, it's more to do with, if you're living in more crowded conditions, if you don't have safe water to wash your hands with, all of that sort of stuff. And I don't think this is going to single out white people. I think it's going to single out everyone. And there's been a lot of discussion in the literature as to whether African Americans are suffering disproportionately from this. And I don't think the work's been fully done on that yet. But that's not something that happens in our book, for instance. This is, in our book, we argue this happened to African Americans 50 years ago. And what you're seeing now was what's happening to the less educated whites. But this COVID is not a death of despair. It's something different.
And you wrote then, to kind of turn to the other issue you just mentioned, you and Ann Case wrote an article in the New York Times about what this is exposing of our healthcare system and the many problems with it. Can you talk about some of the issues you think this is really put into the spotlight that will need to be addressed now?
Well, there are really two issues with the healthcare system. Well, maybe three that are relevant here. First of all, it just costs way too much. So it costs twice as much as any other country. And our life expectancy is terrible. And it's one of the worst life expectancy of any rich country in the world. And, you know, maybe healthcare is not responsible for life expectancy, but it certainly doesn't put it in a very good light, especially when it costs twice as much as anyone else's. So this enormous burden, which we're used to talking about, like we say, 18% of GDP, you know, those are really big numbers. You're talking about $4.5 trillion or something. But those numbers just wash around, and people don't usually talk about what it means in terms of real human costs. And so that takes us to the ways in which it's financed. You know, so even if you reduce the cost, or even if you held the cost up but changed the way it was financed, it might be better. And one of the worst things is the employer-based system. And so one of the things that happens is that last year, for instance, an employer who was insuring one of their workers, paying for health insurance, had to pay about $11,000 for a single policy and about $20,000 for a family policy. Well, think if you're a corporate personnel officer or something, and you're thinking about low-paid workers like janitors or, you know, security guards or food service workers, all those folks. And you think, okay, we need those people. How valuable are they to the company? Well, let's say maybe this guy's worth $30,000 a year. That's how much we can afford to pay. That's going to cover the health insurance as well as the wage. Right? So this rising cost of health insurance is one of the reasons that wages have been falling, the graph that Sam showed a little while ago. It's also one of the reasons why there are fewer and fewer jobs, because these companies say, okay, you know, maybe we don't need the security staff. Maybe we don't need the janitors. Maybe we can hire the Ram Jam supply company to provide janitors for our office. And that Ram Jam supply company employs these people. It's what we call outsourcing. But they don't pay them as much. They may not come with any benefits. And also it's a dead-end job. I mean, if you're working for a janitorial supply company, there's no way you can work yourself way up to be a CEO or, you know, or even a good desk job if you're a talented guy that somehow missed out. So it's hollowed out the opportunity for these people. And that money is coming out of their hide in some sense in terms of jobs, numbers of jobs, the quality of jobs, and the wages for those jobs. And, you know, so is globalization, and so are technical change. These are things that are doing bad things to working class people too. But this is one we can actually do something about. This is like shooting ourselves in the foot. You know, we needn't have a system like this, and no other country has a system like this. And every other country pays for healthcare somehow through taxes on everyone.
Right. In your book, you talk about, in regard to this outsourcing of janitors, you quote an economist who describes it as janitors as now people who are not invited to the holiday party because they don't work for the company anymore. They are contractors. They can be let go. For instance, recently here in the news, the university here at Princeton has said that it's doing everything it can to protect full-time paid staff, and employees here at every level are protected. But we also have contract employees. Right. And I have to admit, I'm kind of curious about what's happening to those people who I see every day, who in every way are a part of my community, but they're not protected in the way that full-time employees are protected.
Right. So the pandemic has showed up that fault line too, which is not really much of a focus on our book, which is that if you have a pandemic, we didn't know there was going to be a pandemic, and you shut down the economy, then if you're a contract worker, or you're one of these relatively less educated workers, then you're at risk of losing your health insurance all the time. So are we, incidentally.
The way I'd characterize, as I read Deaths of Despair, this book by Anne Case and Sir Angus Deaton, the way I would characterize this book, it almost, as I was reading it, it felt like two books where there's a part of the book where you lead us through CDC and other data showing how people are dying earlier, specifically whites without bachelor's degrees. You show when they started doing it, where they are doing it. Now in the last bit of this discussion, we've really gotten into causes and solutions. And I was really struck by some things that perhaps you already knew, but were reviewing for the reader, like the curious history of how healthcare came to be provided in the United States, where we in the US do it through the private sector, and you just touched on that. Why did the US diverge in using companies to provide healthcare rather than the national government? How did that begin?
Well, it began as a historical accident during the Second World War, and that there were wage and price controls during the war, which almost all countries had to try and stop there being inflation undermining the war effort. And so companies could not reward their workers. And there were unions at that time, obviously, more powerful than they are now. And one of the things the unions negotiated for was for the firms to give them health insurance. And the health insurance, just by the way the law had been written, didn't violate the prohibition against giving people more wages. So you could give people more wages in a sort of backhanded way by providing wages through the company. And the other thing you need for health insurance is you need some sort of risk pooling. You know, you can't get health insurance for yourself because as soon as you get sick, they'll take it away. Whereas if you do it with a bunch of employees in the firm, so it's a possible way to do it. I think what happened after that, and Julian would know more about this than I do, you know, in the great wave of bringing healthcare to everybody that swept Europe after the Second World War, that wave was not absent in the United States. And Truman talked about it, and there was an attempt to get the burden taken away from employers and shifted to the state. And it founded as much of US social policy does on the issue of race. So the Southern senators, people in the South, had no interest in any sort of universal health insurance, largely because they didn't want white people to pay for health care for Black people. And, you know, that has been there ever since. And I think the attempt to get a British or a German or whatever healthcare system in America sort of foundered, as much of other social policy in the United States did, against that racial divide.
But the deep irony there is that even though race and wanting to deny Black people health coverage may have been at the root of it in the Truman era, looking at the data in your book, Blacks are improving. Black mortality rates for all-cause mortality among Blacks.
Yeah, but we have to be careful here. It's worse, right?
Sure, but what I'm saying is that you yourself point out that gap was wider, and although it's worse, the gap is closed. Right. And so in some ways, Blacks are catching up.
It's just that this is often a very sensitive area. And, you know, we're talking about white mortality rates and so on. And, you know, there's some people who think, you know, why are you focusing on white when Blacks are doing even worse? So it's very important to separate rates of change from levels. And in the levels of the mortalities, Blacks do worse, as they always have. And, you know, whites are doing and do worse, but the rate of change is more favorable for Blacks than whites until 2013. And in the book, we make it clear that this trend has sort of stopped after. That's not the right picture, I don't think.
No, I wanted to move to something else. Please go on.
Yeah, okay. But I mean, after 2013, when the drugs, especially fentanyl, sort of moved into the inner cities, you begin to get deaths of despair among African Americans too, which previous to that you had not had. And that was, you know, the fentanyl, the story for that, which I think NIH and things believes, is that, you know, there were a fair number of people who were consistently using, for instance, heroin or cocaine after previous drug epidemics, and then fentanyl started getting into the supply and people started dying.
Absolutely. I'm certainly not meaning to minimize the higher death rates among Black Americans, among white Americans. The only thing I wanted to show is something that struck me. This is figure 12.2, and this is presidential election turnout, in which turnout is higher among Blacks without a bachelor's than whites without a bachelor's. So I just get this idea looking at this figure surprised me somewhat. I was really interested in the fact that Black Americans are more likely to vote than white Americans without a bachelor's degree.
Mind you, there are two Obama elections in there, which had a lot to do with that.
But it's higher for every year other than 1990.
Yeah, no, that's right. And in fact,
I see your point.
Yes. So
okay.
the gap widened more because of Obama.
Right.
But you'll see in the book there are several indicators where once you disaggregate by educational status, BA versus BA, non-BA, Blacks are doing as well or better than whites, which is really extraordinary. Something that Bob Putnam's been saying for years and also getting into trouble with is that race has diminished in importance relative to class, at least if class is defined by educational status. And so the big issue here is that Blacks are much less likely to get a BA than are whites. Once they get a BA, they do as well or worse than whites, as well or better than whites. And without a BA, the same is true, but the proportions for the BA are very different for the two racial groups.
It reminds me, not to lower the discussion, but it reminds me of the Saturday Night Live sketch of Black Jeopardy, in which one of the contestants is this white guy played by Tom Hanks. And it emerges that he has all these cultural values that are really reminiscent of values held by the Black contestants, but they're just separated by this racial divide, yet their answers are so similar.
If you want more comedy on this, Dave Chappelle has been pushing this for some time. And he has a Netflix thing called Sticks and Stones, in which all the whites are drug addicts and, you know, the Blacks never commit suicide and all the rest of it. So it's a very complimentary thing to the book. It's very edgy though, so I wouldn't necessarily recommend it to all.
No, I understand, and I certainly don't mean to step on any rails here. I did wanted to bring this back to national politics a little bit. I think there's so much to say, but I want to go back to an earlier part of your book just to show people this picture, which is now a picture of all-cause mortality among people, I believe, 45 to 54, white non-Hispanics. And the top map is 2000. The bottom map is 2016. And there's this swath of places where the death rate has become, of all-cause mortality, has become quite high in this group of midlife people. And I have to say the geography of this reminds me of other kinds of things that I think of when I think of US politics. So I couldn't help, when reading Deaths of Despair, think about this category of Americans who feel left behind, who are not helped by the health insurance system, whom automation has created jobs far away from where they live. And here they are in these states where it's almost like I can feel their resentment in your graphs. And I wondered to what extent you felt that that was a strong connection.
Oh, I think there's a very strong connection there. And that map is largely explained by education. And in fact, you know, if you look at the states where they've all gone up, if you look, that graph's going to be too small to see it, but the I-95 corridor is one where, you know, the rates have really not gone up, and California along the coast too, and the upper Midwest.
Appalachia is heavily shown.
Yeah, but there's a lot of people who've been, as you say, left behind, and you know, and you know, these things all seem to go together. So, you know, there's all this pain, there's lack of jobs. And I think the politics of this have been very, very important too. So the Democrats in the early 70s seem to have made a more or less conscious decision to move away from representing working class people and move towards a coalition of minorities and educated elite. The Republican Party is largely a party of business. And so the people who've been the backbone of the Democratic Party up until the 1970s were sort of excluded from politics and not really represented by anyone anymore. And I was talking the other day to a prominent Democratic congressman who said that, you know, when he goes and talks to unionists, he gets a much more difficult reception than he does if he's talking at a university or he's talking, you know, to educated people. And that did not used to be the case.
Right, we're almost out of time, but I did want to ask you one question. One of the things Sam and I have always been interested in are the different contributions disciplines make to understanding these problems. You're one of the great economists, and I'm curious what you would tell our audience, non-economists, non-academics. How do you see the role of economics as a tool in solving some of the social questions that you have focused your work on?
That's not an easy question for me to answer, and I'm certainly not a typical economist. And one of the things we learned writing this book was just how much other disciplines had to contribute to this. And a lot of the answers, a lot of the stories we tell came from talking to sociologists and political scientists, talking to Bob Putnam, talking to Sarah McClanahan, talking to Andy Cherlin, all of whom have written incredibly wise things that are not really part of the economics literature. So, I've certainly been on this kick for quite a long time. And it's something I love about the Woodrow Wilson School, which is that we have these disciplines all pulled together, and you have the chance to work with and talk to people in other disciplines, sometimes just by the proximity. I had an office next to Danny Kahneman for like 5 years, and it changed my life. And worked on lots of things that I wouldn't have worked on otherwise. So I think the economic insights are very important, but they can be exaggerated. I think economists are also very well trained in technical skills, and less so among other social scientists to some extent. So it's very easy for us, given where we came from, to make use of the world of big data in a way that's often harder for other people. I've actually been very proud of my discipline, the extent to which, for years, economists seem to ignore any social problem. It was sort of like, we'll deal with that 10 years from now. But the outpouring of papers over COVID has just been absolutely extraordinary. And really good economists working on this from all sorts of different ends and bringing their skills and to look at this. And I think they're making a real contribution.
I feel like we could even have, we didn't really get into it, but just the neuroscience of pain, addiction, and the ways in which fentanyl and OxyContin have really played a role in what you described. There's a whole ocean of stuff there. Again, an opportunity for a whole other conversation about technology, medicine, and what these things are doing to people.
No, that's right. And we're going to have that conversation again over the next years as we discover what COVID is going to do. Our economy has not really been proofed against infectious disease for a very, very long time. Because the infectious disease are only a tiny fraction of all mortality. And then suddenly we get into a world where that's not true. We're going to have to rethink our nursing homes. We're going to have to rethink our cruise ships. We might even have to think the Navy, rethink the Navy. And all this distance communication that we're doing now is going to change things. Often this works for the worse. It would have been much more fun for the three of us to sit together and talk about this. But on the other hand, I give one of these webinars and I discovered that 3,000 people watched it afterwards. And that's very different from the usual talks we academics give where there are 15 or 20 people. And it's good in some respects, and not as good, but it's going to change the world in which we operate.
Well, unfortunately, we're out of time. I want to thank our guest, Sir Angus Deaton, again, recipient of the Nobel Prize in Economics, a colleague of ours here at the Woodrow Wilson School and co-author with Ann Case of a terrific, important book, Deaths of Despair and the Future of Capitalism, which came out with Princeton University Press. Sam showing the cover if you're watching instead of listening. But thanks again for joining our show.
Thanks, Julian. Thanks, Sam. Great.
Once again, you can find us on iTunes, SoundCloud, Stitcher, and Spotify, or visit our website, politicspolls.princeton.edu for information and show archives. Thanks for joining us, and we'll be back soon on Politics and Polls.
Bye, everybody.